Good morning, Ms. Vaughn.
Yes.
My name is Marion Rupp. I'm a discharge coordinator here at Sisters Hospital.
4 days ago, Mrs. Vaughn was admitted to the hospital and was diagnosed with congestive heart failure, sometimes referred to as CHF. She had successful treatment and her condition is now stable. Although she no longer requires the comprehensive medical care of a hospital, she does require nursing care, along with rehabilitation to help her function independently and to get back to doing the things she's always enjoyed. One of the benefits of choosing the Catholic health system is access to special care paths that have been developed for diagnoses such as CHF. The care path continues from your inpatient stay through all levels of care in the system.
We have many settings within our Catholic health system, and you'll find that the transition can be quite simple.
Subacute services are often recommended for adults of all ages. Patients may be managing chronic pain or a chronic illness like congestive heart failure, or they may be recovering from an injury or orthopedic condition like a bone fracture or joint replacement. This level of care is designed for people who need a transitional care setting between their hospital stay and their return to home. While you may search extensively for the best physician to help you, the same efforts should be given in finding the right rehabilitation facility for you. When you choose Partners in Rehab, you benefit from the tremendous number of resources supported by the Catholic health system. You will receive therapy 6 days per week at facilities with dedicated subacute units. We're committed to maintaining the highest of standards and therefore continuously measure our patients' outcomes. The results are very reassuring. Our outcomes are consistently at or above the national standard. We've won national, state, and local awards for our quality initiatives, and our patient satisfaction is evident with positive results in overall satisfaction and recommendations to our facilities. At our Partners in Rehab facilities, you'll be greeted by friendly staff and feel right at home. The patient becomes the focus of a caring and compassionate interdisciplinary team who evaluates your unique needs and develops a care plan that's specifically designed for a quick and safe recovery. Recreational activities are available for both patients and their families to enjoy when not in therapy. Let's meet the members of this team. Heading the team is a physician who will evaluate the patient's medical condition and rehabilitation needs. The physician will prescribe any appropriate medications or medical treatments, along with a rehabilitation therapy plan that will restore the patient's health, strength, and function. The physician may also prescribe a special diet for the patient if necessary. Throughout the patient's stay, the physician will confer with other members of the team to evaluate progress and modify the treatment and therapy plan as needed. A physician is also available 24 hours a day to respond to any medical emergencies that might arise. Another member of the team is a registered nurse who is responsible for coordinating the overall care of the patient. The patient's care plan has been developed with input from the entire team of caregivers. They are available around the clock, 7 days per week. The nursing staff gives medications which may include running an IV or monitoring the patient's insulin if they're diabetic. Time is spent with the patient to make sure that everything about medications is understood, what they're for, how often they should be taken, and any possible side effects you may encounter. If the patient has a wound, possibly from surgery, the registered nurse will also provide wound care. The team includes certified nursing assistants, or CNAs, who help patients when they need assistance with activities of daily living, like bathing, grooming, or getting dressed. As patients get stronger, the CNAs won't need to help as much, although they are always nearby if the patient needs help, or someone to make them smile. Another important team member is the Occupational Therapist, or OT, who helps patients learn to do certain activities of daily living that are difficult to perform because of their condition. Frequently, CHF patients develop swelling in their legs, and the physician may prescribe special hosiery to help control the swelling. OTs also teach patients how to use assistive devices like this sock aid, which will make it easier to dress until they have regained enough strength, mobility, and control to do this without the device. The Partners in Rehab team also includes the physical therapist, or PT, who works closely with patients throughout their subacute stay. As the PT guides them through physical therapy and exercises, the goal is to regain strength, endurance, range of motion, and physical coordination. Sometimes it's difficult work for patients, but our PTs are there to give encouragement and support. Although this didn't happen to Mrs. Vaughn, if a patient has lost the ability to speak or comprehend language due to their illness or injury, the team includes speech-language pathologists who help patients regain those skills. These therapists also help patients with their ability to swallow foods and liquids safely. They assist the dietitian in developing meal plans that will provide proper consistency and nourishment. Other members of the Partners in Rehab team include chaplains, who are available for spiritual care, and care managers, who work with our patients and their families to help them make appropriate arrangements for the patient's discharge to home or another setting if necessary. This might include special equipment needs, in-home nursing or rehab services, or arranging appointments for outpatient therapy. Most importantly, all of these individuals we've met work together as an interdisciplinary team to ensure that patients like Mrs. Vaughn achieve their optimal outcome as quickly and safely as possible. We see evidence every day that our Partners in Rehab subacute team is fulfilling the mission of the Catholic health system and its long tradition of healing with compassion and respect for the unique needs of each person we serve.
While many people feel that they should rely on friends and family, they really do need to consider something like Partners in Rehab. There are people here who are completely and solely focused only on my well-being, from the emotional to the physical to the occupational, even dietary needs. Everyone was very focused and very encouraging about wanting to make sure that the patient's needs were met, that I was happy and comfortable, and encouraged me to get better. I cannot say enough positive things about the entire process of having been here.